We're hearing a lot about get vaccinated, right, and get boosted, and those are important, but not hearing as much with this current Omicron surge talking about people wearing a mask or social distancing. Are those still important? They are very critically important at this point in time. And I wish there was more messaging talking about your activity level, social distancing, the number of interactions you have with other individuals. And it's like many of the other surges have been like rising tides, right? They happen slowly. This Omicron surge is a flash flood, right? It is here, all of a sudden, flash flood, overwhelming. And so when you're in a flash flood, don't go into the floodwaters, right? I think that's just safe and logical. Don't go into the floodwaters. And if you do have to be near that water, the highest quality mask that you can wear with the best fit around your face is what is most important, filtration and fit. And so the highest quality mask, a surgical type mask that has the better filtration, a KN95 or an N95, I consider those functionally equivalent. The N95s are typically medical devices. The KN95s, if it's sourced from a reputable source and a good fit around your face, that is an absolute great mask to be wearing. And then limit your interactions around others, right? Taking a mask off and eating in a restaurant right now, consider yourself exposed to the air and the aerosolized air of everybody else in that environment. I think that's just the case. And when you look at some of the, currently people are talking about the prevalence, how much coronavirus, this Omicron strain is out there in our environment. And when people look at the number of tests that are reported, the PCR tests that get reported to the state, but so much of the testing now is the at-home testing with the antigen tests that are not reported to the state, right? And then on top of that, people who have symptoms know they were exposed to somebody who has tested positive, but can't find one of those tests and never get tested. And when the estimates are going, you're talking about possibly 1 out of every 10 individuals in our community right now, 1 out of 9 or 1 out of 10 individuals are likely infected with the Omicron strain. That is extraordinary. We've never seen that level of prevalence in our community as we can at this point in time. So getting vaccinated and boosted, very important to protect yourself if and when you come down with the Omicron variant, but also wearing a high quality mask, limiting your interactions, also very important at this point in time to avoid contracting the Omicron variant in this flash flood scenario that we're in. We're near the breaking point. I think you can hear that from us today. Like we are reaching the breaking point. And so the things that people can do to help us is, we talked about get vaccinated. If you've been vaccinated and you're eligible for a booster, get your booster, right? And then wear a mask and limit your interactions. Those are the things everybody listening tonight can do to help us, because our health system is near the breaking point, has passed the breaking point in some areas currently, and that's what we're here to talk to the community about tonight.
We were very fortunate when we did the vaccine clinic that we had some great volunteers from our community that helped us during the vaccine clinic. And so we're reaching back out to many of them to ask them to help us now and to be able to be at the side of our staff, helping our staff that have been here through all of COVID. You know, I wish I could say that we're hiring a whole bunch of nurses and it's going to be great. They're not out there. And so while we may not be able to add a number of nurses, if there's volunteers from our community that we've worked with, we certainly are tapping into them. But even as I mentioned earlier, is looking at our own workforce across Mary Washington Healthcare is, if I can't say to a nurse, I have another nurse that can come to help you, but I can say, but I have somebody who could help you with turning and positioning patients, or I have someone that can help you as far as helping to take out the trash in a patient room, or to be at the front desk to answer phones. Those are all things that also help a nurse that's at the bedside to be able to have more of that time at the bedside with our patients. Our staff are tired, but on the other hand, they're tired less. They have been here through all of this. Each time, you know, every day it feels like there's some new challenge that we're facing, and you think, oh my gosh, how can we do this? And they come through and help us figure that out. So, you know, I'd love to be able to say to them, take a day off tomorrow, you know, don't come to work, take care of yourself. They're trying to do that as well as they can. But what we're trying to do is just look across our workforce, the volunteers that have worked with us, to say, how can they be brought to bear to help our clinical staff that are at the bedside.